So today we are going to study about drugs acting on blood and blood forming organs. What are drugs affecting coagulation and bleeding? They are called hemostatic agents. What are hemostatic agents? These agents arrest the bleeding either by vasoconstriction or by promoting coagulation of blood. So it arrests the bleeding with two methods, vasoconstriction or promoting coagulation of blood. So these hemostatic agents can be further classified into local agents or styptics and systemic agents. So now let's look into local hemostatics. Local hemostatics, they are the drugs which are commonly used to stop bleeding from capillaries or minute vessels. They can also be used on bleeding sites like tooth sockets and some wounds. So the first local agent is called astringent. So they stop oozing of blood from capillaries with the mechanism of precipitation of proteins. So in order to stop the oozing of blood, the proteins precipitate on the local bleeding site. So the examples for astringents can be solution of tannic acid and a solution of ferric sulfate or ferric chloride. Now the second local hemostatic is adrenaline. Adrenaline, it is commonly used on a bleeding site to control capillary oozing. How is this done? It is done by taking a sterile cotton which is soaked in 0.1% adrenaline solution, and then it is placed on the capillary. So when this is placed on the capillary, adrenaline being a vasoconstrictor, it causes vasoconstriction of the capillary blood vessel, and now the bleeding stops. And the adrenaline, it should be avoided in patients with hypertension, ischemic heart diseases and uncontrolled hyperthyroidism because it may cause myocardial infarction, and it might also aggravate the present condition. So moving on to the next local hemostatic, thrombin. A thrombin is a freeze-dried powder which is derived from a bovine plasma or a human plasma. A bovine plasma is a buffalo plasma. It is applied topically over the skin. So topically means over our skin. It should not be injected. It should never be, because a thrombin is a coagulating agent. So when it is injected, it forms blood clots in the flowing bloodstream and it blocks the normal blood flow. And when there is a bleeding, it is placed in a tooth socket in order to arrest the bleeding. Next local hemostatic, fibrin. A fibrin consists of fibrinogen, factor 13, thrombin and other clotting factors. This fibrin can be used to control bleeding during surgical procedure or as a spray on the bleeding surface. And the fibrin is obtained from human plasma and it is also available as sheaths. The fibrin sealant and tranexamic acid mouthwash, it helps in reducing bleeding during dental extraction in hemophilic patients. The next hemostatic is gelatin. This is an absorbable local hemostatic. It is available as sponge or a film. It promotes hemostasis by providing a meshwork on which the clotting occurs. So it provides a meshwork or a network where the clotting occurs. So the next local hemostatic is calcium alginate. It is obtained from seaweeds, and now this is again absorbable and it is used to promote wound healing. Wound healing is again by clotting and healing. The next local hemostatic is oxidized cellulose. Oxidized cellulose is absorbable. It is applied dry and it swells up and forms a clot. It is used to control bleeding of capillaries where ligation is not possible. Ligation means joining. It may cause tissue necrosis or nerve damage. Now moving on to systemic agents. The first systemic agent is vitamin K. Vitamin K is a fat-soluble vitamin which is required for synthesis of many clotting factors such as factor 2, factor 7, 9 and 10. This vitamin K exists in three forms: vitamin K1, vitamin K2 and vitamin K3. All these three forms of vitamin K are naphthoquinone derivatives. So, the action of this vitamin K is it acts as a biosynthesis for clotting factors. It also acts as osteocalcin, which is a bone protein which is important for bone development. And now the deficiency. The deficiency of vitamin K is caused by inadequate absorption or by liver diseases or by long-term antibiotic therapy. It can also manifest a bleeding tendency. The adverse reaction of deficiency of vitamin K are seen in parenteral administration leading to jaundice. Now the uses of vitamin K. In obstructive jaundice with hemorrhagic symptoms, parenteral vitamin K1 is preferred, and vitamin K1 is used in neonates to prevent the bleeding, as the intestinal flora which is necessary for the synthesis of vitamin K is not developed. This vitamin K can be used in neonates. Now moving on to the second systemic agent, that is fibrinogen. This fibrinogen is obtained from human plasma. It can also be infused intravenously to control the bleeding in the body. And the next systemic agent is adrenochrome monosemicarbazone. It is available for oral and parenteral administration. It can be used to control capillary using which is followed after tooth extraction or epistaxis. The next systemic agent is anti-haemophilic factor. So this anti-haemophilic factor has coagulation factor 8 with von Willebrand's factor. This controls bleeding in case of hemophilia, and this is administered into the body through IV fusion or intravenous infusion. When the adverse effects happens, the symptoms include fevers with chills, headaches and skin rashes. The next systemic agent is ethamsylate. Ethamsylate is a hemostatic which is available as intramuscular and intravenous administration. It corrects the abnormal platelet adhesion. It also maintains the capillary wall. It is developed to be well absorbed in oral administration, and it is secreted in breast milk, and it is excreted unchanged in the urine. So it is also used as prophylaxis, and it can also be used to control the bleeding from blood vessels. Now moving on to the last systemic agent, which is desmopressin. Desmopressin is a synthetic analog of vasopressin. It is used to control mild to moderate bleeding in hemophilia A or von Willebrand's disease. It is infused into the body intravenously. Thank you.